TCM perspectives on menopausal hot flashes. Menopausal hot flashes don't exist in a vacuum. They exist accompanied by many other signs and symptoms because they exist within the totality of menopause and often within the totality of perimenopausal syndrome, which is something that we may be actively treating, and this may be actually the chief complaint, right? And so one of the ways that we can make sense of the hot flashes if we want to think about them from a Chinese medicine perspective in order to dial in the specifics of what we're doing is reframing them into a Chinese disease category. And I'm going to have a lot more to say about reframing as we move into Western gynecological diseases. However, suffice it to say, I will briefly introduce this idea and the books that we often use in order to reframe here, just to give you a taste of what I'm talking about. So when a patient says, I have hot flashes, the first question you have to ask is, well, what do you mean? What are the very specific signs and symptoms of the hot flashes? And oftentimes those signs and symptoms are diseases in Chinese medicine. They're actually diseases that have names. So they might say, oh, I sweat a lot, specifically in my head. And you say, oh, well, that sounds like head sweating, which is a disease in Chinese medicine. They might have head heat. They might have hot flashes in the head and face. They may have a red facial complexion coupled with a couple of these other ones. They may have a thing called redness above the cheekbones. They may have a thing called tidal hectic fever, which has to do with the timing of the hot flashes. They may have the classic vexatious heat in the five hearts, which is the one that we learn the most about in school. This is most often associated with the Kidney Yin vacuity heat, vacuity fire pattern, where they have hot hands, hot feet, and then like hot in the center of the chest or hot in the heart. And then there's also just straight up night sweats, okay? So these are individual diseases. I'm going to back up here to this slide too. These are individual Chinese diseases. And what do I mean by that? Well, Philippe Ciano wrote these books, okay? I'm going to bring this up a little closer. It's called The Treatment of Diseases in TCM. And it's a 7-volume set that I recommend you have on your desk or your bookshelf at all times because it is incredibly valuable. It is the subject of another program entirely, but these books are something that you want to have, and they're definitely part of our recommended list of books to have, okay? So the idea here is that you could look up any one of these based on the symptoms that the patient has, and this will give you a breakdown of the most likely patterns that are going to be driving that, and then you can then figure out, well, my patient is exhibiting these patterns. So that's a way that you can kind of go into this if you want to get a little bit more granular. See, I've got herbs on my mind all the time. If you want to get granular in your diagnostics, you can dial it a little further with these books, or you can just go very broadly, which is really most of the time going to be perfectly okay. But again, I want to set the stage and I want to give you more tools to use as you become a specialist in this area, okay? All right, so the question you have to ask yourself in the case of menopausal hot flashes in particular, but heat in general, any heat symptoms, is where is the heat coming from? That's the thing that we have to figure out as the doctor is where is the heat coming from in order to really be able to effectively treat it. And oftentimes it's a combination of different things that we need to treat. All right, so the standard answer that we learn in school is Kidney Yin vacuity, vacuity heat, right? That's the classic. They have menopausal hot flashes. It must be Kidney Yin vacuity, vacuity heat, vacuity fire, okay? This is, in my opinion, and in clinical reality, really seldom the actual solution to the problem. And the reason why this is the solution to the problem is because Kidney Yin vacuity, vacuity heat, with very, very few exceptions, would never occur by itself in real life. And the reason why this doesn't happen is because this is textbook. And when we learn these patterns, we learn them in a textbook way. We learn liver depression chi stagnation. We learn spleen chi vacuity. We learn heart blood vacuity. We learn kidney yin vacuity, and it has all of these associated signs and symptoms. And yet in real life, our patients never really look like this. They don't have just this, and that's it, right? That would be ridiculous. And the reason why it's ridiculous is because kidney yin vacuity is simply a continuation of liver blood vacuity. Liver blood vacuity comes from a spleen chi vacuity. Spleen chi vacuity usually comes from liver depression invading the spleen or intemperate eating or overthinking things. In other words, we know that in order for the kidney yin or yang vacuity or to be affected, kidney yin or yang to be affected, that first, as part of a continuum, the middle jiao must be affected. And once the middle jiao is affected to the point where kidney yin and kidney yang vacuities are showing up, that middle jiao problem doesn't just disappear. The kidney yin and yang vacuity get added to it. So you don't just have kidney yin vacuity and therefore you give Liu Wei Di Huangwan or Zhibai Di Huangwan or Arshintang or, Arshintang and Arjuwan, right? I mean, that's fine and it might help the patient a little bit because it's treating the kidney aspect of the problem, but it's not going to completely facilitate the correction and the transition into menopause that this heat is being generated from, right? So let's look at something that's a little more realistic in the real world that you're going to see, all right? A very common multi-pattern presentation that's resulting in hot flashes that you will see over and over and over and over again in real life, some variation of this combination, okay? Liver-spleen disharmony, depressive heat mixed with damp and or phlegm, okay? And it can often present with kidney yin, kidney yang vacuity, dual kidney yin yang. That's fine. Those things are often present, but they're not going to be the main things that we're going after, and they are very unlikely going to be the things that are driving the expression of heat in most modern patients. And as we explained, most modern patients, based on our bell curve, it's this middle jiao issue. And it's always this middle jiao issue, even when we ultimately are presenting with kidney signs. The middle jiao is still a problem. So this is much more likely to be the issue, especially this damp heat, liver depression, spleen qi vacuity combination. This is a big one, okay? That's why things like Jiawei Xiaosan and then the addition of things like Wenden Tang or Juru Wenden Tang or Huanglian Wenden Tang, Sanren Tang, those damp heat, phlegm, heat, coursing the liver, rectifying the qi, mixing these formulas together in these types of presentations is so much more effective for modern patients because they are suffering from a complex of 3 to 5 simultaneous patterns that are driving their hot flashes. So you would adjust these formulas in terms of their percentage or their ratios based on the severity of the dampness and the heat, the liver depression, etc., right? Could you add medicinals in for kidney yin and yang vacuity? You could, but those medicinals do tend to be cloying. They do tend to be thick and heavy, and they tend to further damage the middle jiao, which is why generally we don't go for those. We try to correct the middle jiao as much as possible and hope that the kidneys can then make a recovery. And if not, we can gently supplement the middle jiao after that and maybe add a couple of medicinals for the kidneys after that, okay? But this is a typical, very typical real-life presentation, okay? Liver depression, spleen qi vacuity, depressive heat mixing with damp and phlegm, very common. And also, because blood and body fluids move together, if there's dampness and phlegm, there's almost always some degree of blood stasis also. So if you see signs and symptoms of blood stasis mixed with the previous pattern, you may want to think about adding some medicinals to quicken the blood and dispel stasis, because again, where any of these fluids or qi stop moving appropriately, they tend to generate heat. So if it's liver depression, it's depressive heat, right? If it's dampness, it can be damp heat. It could be phlegm heat. If it's blood stasis, it's static heat, okay? Either way, making sure the blood's moving, making sure that the dampness and the phlegm are transformed back into usable, nourishing, cooling, moistening body fluids, and making sure that the qi is rectified and coursing, clearing out the heat that comes from that depression, is the way that we ultimately treat these hot flashes, okay?